This conference will now be recorded.
That she participated in. And so the people that we really aren't close with, our acquaintances,
Hey Janet, this is Bryson.
Hey, I'm here.
Hey, okay, so we're all I'm sitting in Dr. Murphy's office, and Salento Anderson, our director, is also in here as well.
Okay. So
Um,
you're calling in on the phone right now, right?
yes.
Okay, I'm popping you in there. That being
Um, One thing I was going to mention real quick: are you doing the introduction on behalf of the chamber, or is someone else?
I was going to, but I think Angel's gonna do it. So
Okay. When she joins you, or if you can let her know when you guys turn it over to us, will you turn it over to Salento first, not Dr. Murphy?
I sure can.
Okay.
And then he will hand it off, and then you'll just need to tell me whenever I need to switch presenter over to you.
Okay.
So I guess I do that whenever you want me to do that after she introduces Dr. Salento.
Yeah, he's not a doctor. Yeah.
Oh, sorry, Salento.
No, you're good.
My bad.
You're good. It just made him chuckle. Yeah. So after you guys do y'all's introduction with your PowerPoint, if you want to introduce Salento and then turn it over to me, I'll just have that PowerPoint. I'll have our stuff. The only thing pulled up on my computer, so it'll be fine to
Okay,
share.
and you'll click what's called a clean. If there's like a clean screen, and it'll only show just the PowerPoint.
Okay.
Like there's a little box to check, and that way it won't show like your bars underneath or anything, or like your go-to-meeting stuff up front or anything like that. Now,
Okay.
caller one is Linto called in on a different phone.
We're all
in the same office.
Okay, that's what I needed to make sure of because I had to figure out who there was somebody else called in, so I wanted to make sure we turned it over and unmuted the right person. All righty, well we will hang out for 10 minutes and then get going.
Okay. So yeah, once you guys hand it over to Salento, he's going to introduce Dr. Murphy. Dr. Murphy's going to talk. We'll open it. Salento will open it up for questions. If you'll just help us with the unmuting at that point. And then he's going to introduce me. I'm going to talk for a few minutes, and then we'll just open it back up at the end for any follow-up questions, and then we'll give it back to you guys.
Okay, that's fine. Do y'all have can you see the chat box on your end?
Can you see the chat box?
I may have to moderate your questions for you if you can't see the chat box.
Click that one, yeah.
Yeah, I can see it.
Okay, good deal. Then the questions will actually come through there, so I can moderate them if you want, or if you want to read them out as they come through, that's fine too.
Okay.
And I just talked to Angel, and I'm going to introduce you, so I know what to do.
Okay.
/employer code.
And that's just the one following history.
Yeah, or for reference afterwards.
Right.
So, to implement.
And if y'all don't mind while you're sitting there, I would mute your phone.
Oh, yeah.
Okay. All right.
Okay.
Hey, Janet.
Yes.
I'm gonna give you my cell phone number, just in case you need to text me while we're all presenting and stuff like that, or if I need to text you, if you're okay with that.
Yeah, I'm good with that. Here, hang on, let me pull it up.
It's all right. I'm just gonna give her mine. She can text.
Okay, I'm ready.
It's 803-237-2456.
All right, I got you.
All right.
I'll,
If you'll just send me a text, and then, like I said, if you need me or if I need you, we can just text.
all right, sounds good. Doing it now.
All right. Thank you.
You're welcome. Everybody, we're going to get started here in about 5 minutes if you'll just hang in there for us.
Huh?
We're going to begin y'all in about 1 minute. Hey everyone, and welcome to the Greenwood, South Carolina Chamber of Commerce webinar series. My name is Janet Ballsiger, and I will serve as your moderator for today's session. We would like to start out by thanking Duke Energy, the title sponsor for our 2020 Spirit of Small Business Initiative. Duke Energy is helping to keep the spirit of small business alive during these unprecedented times by supporting their customers and communities with up-to-date information, financial resources, and community donations. During the presentation, your phone lines will be muted, so you will be unable to verbally ask any questions to the presenter. If you would like to ask a question, you may do so by using the chat box, which is located towards the top of your screen. Just type your question in, and we will answer as many as possible at the end of the presentation. Today, we are pleased to host Dr. Dennis Murphy, Medical Director of Occupational Health Services at Self Medical Group. Today, Dr. Murphy will share recommendations for screening employees for COVID-19 and what to do if your employees have symptoms. We'll also learn best practices that local employers are using to keep their workforces safe. Dr. Murphy, thank you so much for taking the time to speak with us today. And now I'm going to hand the session over to Dr. Murphy's team.
Thanks so much, Janet. On behalf of Self Regional, we certainly appreciate the Chamber giving us this opportunity. My name is Salento Anderson, and I'm the Director of Occupational Health Services. As Janet mentioned, our agenda for today is divided into two sections. Dr. Dennis Murphy, our medical provider here at Occupational Health Services, will speak about COVID-19 and employee screening recommendations. He will also share some general information. After Dr. Murphy presents, our employer liaison, Mr. Bryson Boaknight, will share how local businesses have collaborated during this pandemic and examples of best practices. We will have questions at the end of each section for Dr. Murphy and for Bryson. With that being said, I'm going to hand things off to Dr. Murphy, our medical provider for Occupational Health Services.
Good morning. Thank you for being with us today. As they've already said, my presentation is going to be fairly brief. I know you've been inundated with information about COVID-19, and I'm going to be limiting this discussion specifically to screening employees because it's important to keep infected or potentially infected individuals out of your workplace so that you're not spreading the disease in your workplace. It does appear that some people can be infectious, spread the disease without having obvious symptoms, and so we're going to address those issues. The documents I'm referring to, the questionnaire, these recommendations are available at selfregional.org/COVID-19-info-4-employers. So you can download these documents if you choose to later. The most important thing is to educate your team members and enforce behaviors that are demonstrated to lower the risk of spreading the infection in your workplace. These major behaviors are social distancing, or actually that's physical distancing and staying at least 6 feet apart, washing or sanitizing your hands very frequently, don't touch your face. If you have to cough or sneeze, cough into your elbow sleeve or into a tissue and then immediately discard that. Sanitize high-touch surfaces frequently, and stay home if you have any symptoms. Don't go to work sick. On the sanitizing high-touch surfaces, we actually have individuals assigned in our office to go through every room, every office, once an hour, and using hand sanitizing wipes, cleaning telephones and the telephone keypads, keyboards, mouses, cell phones, pens, clipboards, and the restrooms, the doorknobs and sink handles and grab bars, anything that people are likely to touch, we're sanitizing at least once an hour, and in patient visit rooms after every encounter. So frequent sanitizing high-touch surface areas is a high priority. It is reasonable and acceptable to allow or require all employees to wear a mask, but here's the issue with masks. Masks are very effective at keeping an individual from spreading the infection if they have it, whether they know they have it or not. So if they're coughing or something, them wearing a mask is very effective at preventing spread of that disease. It's questionable and certainly of less benefit in protecting an individual from getting the disease from other people. The best prevention to keep from getting disease from other people is, again, hand sanitizing and surface wipes. And you might even want to consider that outside the workplace. If you go to the grocery store, take wipes to wipe the handle of the grocery cart, and, you know, anything where other people might have touched with contaminated hands and then you touch them and get it. We recommend that you not require employees or team members to have a doctor visit or doctor's excuse to stay home if they are sick. If they say they have an acute respiratory infection symptoms, just tell them to stay at home. There is no specific need for treatment if you have this infection unless you have symptoms that are so severe that you need to be treated. In other words, if you're short of breath, then you need to go to the doctor because you're short of breath. But there's nothing to accomplish by going to the doctor just because you think you might have a COVID infection. The main part of this presentation is screening in the workplace. So what I have written is just a brief protocol. You do not need anybody with any medical training to perform this screening. It's protocol driven and does not require any formal medical training, and no medical decisions have to be made. If your site has individuals with any medical training, medical assistants or a nurse or first medical responders, it might make sense to use those for the screening purposes. But again, you don't really need any medical training. The individuals that you use for this should have demonstrated good judgment and be conscientious and reliable and have some organizational skills. But beyond that, they don't need any special training. One of the forms on the website that I listed earlier is a questionnaire that you can use as it is or modify it to suit you. You may use any or all or none of it, but it does make sense to us to document who you screen and who you send home to quarantine. If you do send anybody home because you're quarantining them, there's a phone number to call at the hospital and give that person's name and date of birth and the symptoms they have, and they can make a recommendation about whether that person should be tested with laboratory tests. And if so, they can call the individual and have them, that's a drive-through thing. You don't go into the hospital, you just drive through, and they can do that test and then report it back to the individual when the result returns. So what is the protocol? We recommend that you test individuals before they even enter the workplace, somewhere right at the front door or at the entrance outside if the weather permits that. Ask them if they have any symptoms of infection: fever, cough, shortness of breath, flu-like symptoms, muscle aches, fatigue, feeling bad, any symptoms to suggest an acute infection or illness, and to measure their temperature. Probably the best way to do it is with an infrared scanner that you just scan their forehead so that you're not touching them. But if you don't have one of those available, an oral thermometer is acceptable. You do need disposable caps that you switch off of the thermometer after each test and then wipe down the handset with a hand wipe if you're using an oral thermometer. So now that you've asked the questions and if they have a temperature greater than 100.4 or reported any symptoms at all, then here's what you do. You want to send them home to quarantine. There are instructions to hand them, handwritten instructions to give them to take home, and those are also on the website that I quoted, so you can print those out to give to the individual. You should give them, if they have any symptoms, if you have masks to distribute, surgical masks or any kind of mask that you can distribute, give them a mask and tell them to start wearing that. If their symptoms are severe, you should do the same thing. Give them the instructions, give them the mask, and send them home, but also tell them to call the appropriate medical provider. If they have a personal physician, call them. If they don't, they can call Express Care, or if they really feel sick, they can call the emergency room, but call a medical provider, tell them what they're having, what symptoms, what their fever was, and what's going on, and they will be given instructions about what to do and where to go. Stress that they should call for instructions before going to their doctor or going somewhere, because a lot of medical facilities have alternate setups right now because of all of this. So it's best, if they can avoid it, to not just show up somewhere, but to call and get instructions of how the best way to get in to be seen is. The next section to consider is, what are the return to work criteria? If you've sent somebody home to be quarantined, how do you know when they can come back to work? If the symptoms were based on temperature elevation and or symptoms, but no lab test was drawn, they can return to work. The quickest they can return to work is 7 days, but it's usually going to be longer. And they can return to work when it has been 72 hours or 3 days since they have had any temperature elevation or any symptoms, and at least 7 days since their first symptoms appeared. So if you interview them on day 1 of their symptoms and they resolve within 4 days, and then they go 3 more days without symptoms, they could get back to work as early as 7 days. But again, it's 3 days of no symptoms and 7 days since the first symptom appeared. If their coronavirus infection is confirmed by laboratory testing, the return to work criteria are the same: 3 days since any symptoms or fever and 7 days since their infection, since their first symptom, and possibly 2 negative tests at least 24 hours apart. And that depends on whether testing materials are available. You know, they've been up and down whether we have enough materials to do all these tests. And the CDC recommends getting 2 negative tests before returning to work if the testing is available. If it's not available, then you just go based on symptoms and duration of symptoms. The final part of this is, what do they do when they return to work? They've met the criteria to come back to work, so now what do they do? They should wear a face mask at all times in the workplace until all symptoms have been completely resolved for more than 3 days, and until after 14 days since their first symptom. So they can come back to work, but they have to wear a mask until they have been 14 days since their symptoms began and at least 3 days since their symptoms ended. In this case, the difference between whether they were tested or not is, if they were tested and found to have the coronavirus, then they are presumed to develop immunity. And when they come back into the workplace, they don't have to worry about getting infected again. If they had symptoms but did not get tested, they don't really know that they had coronavirus. They may have just had cold or allergies or the regular flu. So if they were not laboratory tested, then when they come back to work, they still have to follow all of the precautions to protect themselves from potentially getting infected with this virus, since they didn't really have it to begin with. As far as equipment goes for the screening, really the only thing you need is the thermometer and hand sanitizer and wipes. Gloves and masks and gowns and stuff are not required for the person performing this screening. You can wear any of those if they're available and you prefer to wear them, you can. But the only thing really required is to hand sanitize after each encounter. If masks are an issue and you want to obtain masks, Greenwood Mills is producing and distributing masks on request. These are fabric and can be washed. They have to be washed each day in water that's at least 110 degrees with laundry detergent and bleach. The information is on the printed handout sheets of how to reach them. I will at least give you his name and phone number is Terry Latham, and his office number is 864-388-2605. And this is not retail. It's not for an individual to call up and buy 2 masks. This is for organization leaders to call and order a stock of masks to use within their organization. Those are the main points I have on the self website that I quoted. Are links to the CDC that have more fairly brief and simple guidance on how to sanitize your workplace, and more instructions to give to individuals. There's a lot of good information on the CDC website. There is a OSHA brochure, guidance on preparing workplaces for COVID-19. That's about a 35-page little pamphlet. I can give you that number. It's OSHA 3990-03-2020. So that is their guidance on the subject. And I believe that's all of my presentation. If anybody has any questions, I'll be open for that.
Thank you, Dr. Murphy. Again, that our website, that URL is just selfregional.org/employer COVID info. So if you all want to refer to that, please do so. At this time, any questions for Dr. Murphy?
Just a reminder, if anybody has any questions, you can type them in the chat box. And if you do not have the capability to chat, give us like 30 seconds and see if we have any coming through. And then we will open up the phone lines and very carefully do one at a time if necessary.
Okay, the first question is, do the masks need to be N95? And the answer is no. The N95 are medical grade higher protection masks, and they are required for medical personnel doing medical procedures that are likely to generate aerosolized particles into the air. So if they're intubating someone or doing a nasal swab on somebody that's likely to make them sneeze and cough at them. So a medical personnel doing a procedure likely to precipitate aerosolization, those people need N95 masks. For everyone else, a surgical mask or cloth mask is adequate. Guidance, a question about guidance for employees who have been exposed to a fellow employee who tests positive. That's harder to know. I've seen some recommendations that they should follow the same protocol of being quarantined for the 7 days minimum. The one thing to discuss is, what does being exposed mean? It means being in close proximity to that person for an extended period, and or sharing frequent touch items like sharing a telephone or sharing a keyboard and mouse. But just passing somebody or being in the same room with them but not right beside them, like in a waiting room or something, those are not exposures. An exposure is close physical contact and or sharing high touch surfaces. That is what would be considered a exposure that would potentially put you at risk.
And Dr. Murphy, we got one other question. It was, is there a recommendation for a specific type of infrared thermometers that would function well? And that question also had a twofold part. It was saying, what about when we are checking people in their vehicles? And so if you can speak a little more to that one.
Your guess is as good as mine about which infrared thermometer. I mean, if I was going to buy one, I would just have to look at them on the shelf or Google them and pick one. I don't really know a good way to know which ones are better than others. In terms of scanning people in a vehicle, the only real issue of concern is you want to get the scanner close to their forehead, just because if they've got their heater on and it's hot, or they've got the air conditioner on and it's cold, that could have some effect on the temperature. But really, if you just get pretty close to their forehead, that's about the best you can do with that.
Any other questions for Dr. Murphy?
Let's see, we've got, can you share the link where the guidance can be found? It was not showing the whole link on their screen, I think because of the share screen, it was cutting off the bottom of it. If y'all would share that out loud so they can write that down again, and also the OSHA section number.
The OSHA section.
The OSHA brochure number was OSHA 3990-03 space 2020. It's called Guidance on Preparing Workplaces for COVID-19. I had to type in those dashes to make it.
And our link that we mentioned that you'd be able to find on the Self Regional website is selfregional.org/employer COVID info. So that's selfregional.org/employer COVID info.
All right, I'm going to very quickly, we don't have any more comments in the chat box. I'm going to open up the mute in case there's anybody calling in on their phone and not using their computer if they have a question, and we'll give it just a minute, and then if not, we'll pass it back over to Bryson. Everybody should be unmuted now if you have a question. Looks like we are good to go, so I'm going to pop it back over. And Bryson, you can take it away.
Thanks, Janet. Next, we'll have our employer liaison, Mr. Bryson Bouknight, speak in regards to some collaborations between local businesses and industries and best practices as well. Bryson?
Thank you, Salento. So as Salento said, my name is Bryson Bouknight, and I am the employer liaison here at the Occupational Health Office. We are proud to be the health partner of many of the organizations represented on this call today. As Dr. Murphy mentioned before me, we are here to be a resource for you, whether you utilize our services or not. If you have any questions, please reach out to our office. I'll share our contact information with you in just a little while, but I did want to touch on that. Aside from our office being a resource, I'm also proud of some of the collaborations that have formed as a result of the recent events between local businesses. We have been able to connect various organizations with each other to provide additional resources and insight on how their group is handling things, and we appreciate the collaboration. For example, after one local business implemented their employee screening process, they were willing to share their contact information with others, and we're happy to talk to them about what worked and what didn't work in the process. Others have shared our contact information for our office amongst their colleagues, and they have been able to reach out and get their questions answered. On behalf of Occupational Health, I would like to say thank you to everyone for working together as a business community to help each other out and for getting others connected with our office. I would also like to take this opportunity to thank the numerous businesses, organizations, and individuals who made generous donations to the hospital to help us with supplies in this time of need. We're greatly appreciative of everyone's generosity during this time. With information, developments, and recommendations related to the virus changing daily, we want to make sure you have the most information that's up to date and current. Self Regional is continually posting updates to our website and Facebook pages. SCDHEC and the CDC are also keeping their websites up to date with current information. I have the links to those two websites there, but I did want to reiterate that other website that we've mentioned a couple of times earlier. This has got all the information about the employee screening process, the home quarantine, and that contact information for Greenwood Mills. If you visit selfregional.org/employer COVID info, that's the direct link to find all the information that we've talked about. As I mentioned earlier, occupational health is happy to serve as a resource for you and your organization. If you have any questions, need guidance, screening recommendations, or whatever the case may be, please reach out to our office. Our contact information is now showing on the screen. Feel free to contact our main office or to contact me directly, and we will get you the questions and answers that you need. Lastly, we understand that these are uncertain and unusual times, but please know that occupational health remains open to meet the needs of your organization. Whether we have an established relationship with your business or if you are in need of a new health partner, we are here to provide you with all of our services. We are proud to offer drug screening, hearing tests, pulmonary function tests, and our providers are continuing to see patients for pre-employment exams, DOT physicals, and workers' comp injuries. If your organization would like more information about our practice, or if you are interested in utilizing any of our services, please reach out to me and I will be happy to help you. Again, thank you all for joining this call today and for taking time to participate. At this time, I will turn it back over to Salento and Janet.
Thanks so much, Bryson. Any questions for Bryson? If not, thank you all so much. And at this time, I'll turn it back over to Janet.
All right. Again, guys, thank you so much for joining us on the call today. This presentation was recorded. It will be available within 24 hours on the Chamber YouTube page. You'll be able to find that link at the bottom of www.greenwoodscchamber.org. They will also be uploaded to the Chamber website under the COVID-19 resource page. Dr. Murphy, Bryson, Salento, thank you so much. This concludes our call today, and we will see you all again soon.
Thank you all.